Welcome back to the Tooth Be Told podcast. My name is Brandy. I am a registered dental hygienist with a local anesthesia permit. I've been practicing in the state of New Jersey for the last 20 years. And if you are joining us for the first time, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, with the information, the tools, and the resources to improve their dental healthcare experience. So today I wanted to talk about dental sealants. So dental sealants are coatings or coverings that go over the biting and chewing surfaces of the molar teeth or the back teeth that we chew with. So this material, it's a resin material similar to a tooth color filling material. And that material will fill in the cracks and grooves that are on top of the teeth, our biting surfaces, so that food and debris and bacteria cannot get stuck in those really fine grooves and surfaces on the top of the teeth. Who needs dental sealants? So, for the most part, the best candidates for dental sealants are children and teenagers. That's because we like to seal those teeth as soon as they erupt into the mouth. So when they erupt, they should be free from cavities, of course, free from any restorative work or fillings or crowns, because this material can only be placed on the natural virgin tooth surface because it is placed there to actually prevent cavities and to prevent any decay from happening. We usually like to place sealants between the ages of 6 and 14 because those are the cavity prone years per se. So a child's first year molars come in at around 5, 6 years old. So we'll place sealants on those. And then as the other adult molars come into place, the premolars and the 12-year-old molars, we like to place them on as soon as they erupt as well. So just so you guys know, adults can also have sealants as well. However, as I stated earlier, the sealant can only be placed on a cavity-free, restoration-free tooth. So no decay, no prior fillings or crowns or any restorative work because it won't help those teeth. Those teeth have already had decay. The point of having this procedure done is to protect against cavities. And sealants are applied very easily. They can be done just at your child's or at your own routine visit. And basically, you would have a cleaning first to make sure the teeth are very clean prior to placing the sealants. We dry the teeth off. We place a special little blue gel or etching material. I call it shampoo, and it just it roughens up the surface of the tooth so that the sealant material will adhere to the tooth itself. All this is done without having any injections, without having any hand pieces or drills. None of that is used. We just clean the surface off. We place the sealant material, which is a thin tooth colored liquid. I place it in the areas where it should go, and then I use a curing light right on top. So the light is like a blue ultra violet light that dries off the sealant material. Afterwards, you can eat and drink normally with it. It may feel like there's something stuck on the top of the teeth for a few days. Sometimes there's a little extra material on the teeth, and that will grind away with normal chewing and eating. So it should go back to feeling normal probably within a few days or so. So the benefits of having sealants, like I said before, is just that it helps to protect those vulnerable areas of the teeth, which are the cracks and grooves of the biting surfaces of teeth, from getting food and debris stuck in those areas, therefore minimizing the chance of having cavities on those permanent molars. Although the pros totally outweigh the cons, there are some cons to placing sealants. So sealants only last about 5 years, so they'll need to be replaced often. I do have some adult patients who had them done years ago and still have them in place, so they can last longer, but typically they will last about 5 years or so. Um, And like I said, you can't have the sealants placed on existing fillings, any area where there's cavities. And lastly, if the sealant isn't placed properly, if the tooth isn't cleaned off well, then bacteria can be sealed in and cause cavities, which is the complete opposite of what we want the sealant to do. But that is extremely rare. So the pros definitely outweigh the cons. So, lastly, there is no recovery time for this procedure. Like I said, you or your child can go back to eating right away after you leave the office. Not a problem. So, if you guys have any ideas for content, or if you have any questions or concerns, please hit us up at truthbetoldpodcast@gmail.com. And please check us out on our YouTube channel, our Facebook page, our Instagram at Truth Be Told Podcast, and our website at truthbetoldpodcast.com if you have any questions. All right, guys, take care. Enjoy the rest of your day. Bye.